Field preceptors allow EMS students the opportunity to learn and practice in the field setting. It is the responsibility of the field preceptor to provide a quality guided field experience for the student. In doing so, you must proactively provide instruction and guidance to the student while also ensuring excellent patient care. It is important for the preceptor to encourage and support the student's education and hold the student accountable for the course material and the field care provided. Following the completion of all modules, you will have covered the components of the Davidson-Davie Community College EMS Program Field Preceptor Training, including preceptor roles and requirements, student responsibilities, adult learning principles, shift structure and components, student practicum progression, and evaluating students. The goal of the EMS program is to prepare competent entry-level providers in the cognitive, psychomotor, and affective domains. These three domains are equally important, and students must demonstrate competency in all. We wish for the students to be evaluated honestly. We expect the students to progress towards competency, not perfection, and are looking for documentation of progression throughout the program. The preceptor is not the primary instructor, they are a mentor. Unlike what you may do as a field training officer for your agency, preceptors are not here just to evaluate competency. The preceptor's role is to develop students by setting a good example, objectively evaluating, and providing constructive feedback. This process helps the student connect what they have learned in the classroom to a real-world environment of the field. Preceptors must be credentialed, at or above the level of the student's educational program. Preceptors must be cleared providers for at least 1 year, and be in good standing with their agency as well as the North Carolina Office of Emergency Medical Services. Preceptors must be competent and confident, have good communication skills, and be able to create a positive learning environment. Remember that you are considered an extension of program faculty. Additionally, it is important to note that there are federal laws that protect student information and require clinical education sites to protect students against harassment and abuse. Be professional and set an example. It must be stressed that EMS program students must always be directly supervised to ensure safe practices and appropriate learning. The goal is to provide the proper example, encouragement, demonstration, and redirection if necessary. No EMS program student should be left alone while performing an assessment or skill. Fairly and constructively assess the student and provide feedback. Objective criteria are defined for all grading categories. Please evaluate the student with those criteria in mind. Preceptors should continually provide feedback and recognition, and assist the student in developing a plan of action for improvement. Speak with the student privately regarding their performance, and concerns are to be addressed in a timely manner to the clinical coordinator and agency training coordinator. There is more than one way to do things, so be careful not to demand that students do everything like you would do. Effective preceptors will help the student shape their own style in areas where there is not a specific and science-based way of doing things. Preceptors must be able to understand the difference between principles and preferences. Preceptors are required to oversee all aspects of the student's performance. Remember that the point at which to step in and help can be different for various students at different points within their educational journey. Ultimately, the preceptor wants to see the student providing high-quality care for the patient. This means the student performs an adequate assessment, understands the pathophysiology involved in the patient's condition, develops a differential diagnosis from which they can develop a treatment plan from various care options, and thinks critically about the care being provided. Preceptors must have a solid foundation in the standard of care, agency protocols, standing orders, and other applicable guidelines that apply to all aspects of emergency field care of the sick and injured. Preceptors must have mastery of their own skills, to effectively guide and direct students in the performance of theirs. Preceptors will also need to assist students with troubleshooting and improving their skills in light of unsuccessful attempts or somewhat marginal successes. All attempts must be properly documented, and students are awarded credit only when skills are performed successfully. Ultimately, the EMS program expects preceptors to be active participants in EMS student learning. The information, skills, and guidance you provide will have a direct impact on the lives of others, including the student as well as the lives they will eventually touch. Challenge the student to be supportive, answer questions, provide a positive learning experience for the student, and have some fun and enjoy your time serving as a mentor for the student. Team leads are a capstone skill performed by paramedic students after all other components of the program have been completed. According to the National Registry and the Committee on Accreditation, the student has successfully led the team if they have conducted a comprehensive assessment, not necessarily performed the entire interview or physical exam, but rather been in charge of the assessment as well as formulated and implemented the treatment plan for the patient. This means that most, if not all, decisions have been made by the student, especially formulating a field impression, directing the treatment, determining patient acuity, disposition, and packaging and moving the patient, with minimal to no prompting needed by the preceptor. And no action was initiated or performed that endangered the physical or psychological safety of the patient, bystanders, first responders, or crew. Team leads should provide the field preceptor and the program faculty the opportunity to adequately evaluate the competency of the soon-to-be graduate. Team leads must take place in a 911 system on a transport-capable ambulance. While not every team lead requires the patient to be transported, a comprehensive assessment, differential diagnosis, and treatment plan must be completed by the student. For example, routine rehab of firefighters on a structure fire scene will not count. Additionally, team leads may not be obtained during interfacility transports, unless the transport is from a lower level of care to a higher level of care in an emergency setting. For example, a small rural hospital may transfer a critical patient to a trauma center, which would count as a team lead, while transporting a patient from the hospital to a nursing home does not. Students are not always performing team leads during field experience. Students may attend field experience early in the program functioning as a team member. The capstone field internship is mandated by the accrediting agency and National Registry as a capstone component after all other items are completed. Sequencing is an important component of the National Registry Psychomotor Competency Portfolio, and is clearly defined in the Committee on Accreditation Student Minimum Competency Tables. Prior to the assigned shift, the student is expected to arrive early and in the EMS program uniform. The student is expected to be professional, have a good attitude, and be eager to learn. Every field experience shift should begin with the expectations for the student and the preceptor. Preceptors should find out where the student is in the program and discuss reasonable expectations for the shift. Review the student's approved skills. You can find the list at the link provided. Ask the student to review any past documentation, and if time permits, orient the student to the facility, base, or department, along with the organizational practices that may be important. Remember that the clinical education experience is an ongoing conversation. Students should not be expected to run the call on the first field experience. Give directions as appropriate for the student's level in the program, and adjust the student's role as the student gains confidence. As a preceptor, you should be discussing the patient's circumstances and care with the student, even before patient contact is established. From the time of dispatch, the student should be formulating potential differential diagnosis that may be possible. Plus, some focused questions that may be pertinent to ask to either support or rule out those different diagnoses. Once on scene, the student should develop a general impression of the patient. An adequate history should also be obtained, along with a set of vitals and a physical assessment. With this information, the student should then be able to refine their differential diagnosis and develop a treatment plan based upon that diagnosis. Once treatment is initiated, it is of vital importance for the student to reassess the patient, obtain another set of vital signs, engage whether or not the implemented treatment plan is working, or if other alternatives should be considered. Additional information, including any pertinent positive and negative examination findings, should be documented. There should be a clear discussion at the beginning of the shift regarding expectations, and a clear discussion of the student's performance at the end of the shift. Students are not permitted to leave early without permission from both the preceptor and the clinical coordinator. Students are expected to properly manage their time, allowing for ample opportunity to fill out required documentation both for the student and preceptor. When the student leaves a field site, all paperwork should be completed and evaluation should be submitted. A reminder to evaluate with honesty. Students should not expect to receive perfect scores. EMS students are informed that field sites may dismiss them for any legal non-prohibitive reason. It is understood that inappropriate behavior or any unprofessional attitude are also grounds for such dismissal. If a dismissal does occur, the clinical coordinator should be notified as soon as possible with details pertaining to the dismissal. Adult learners will feel the need to take responsibility. It is important for them to have control over their learning. They will perform self-assessments, and will expect a peer relationship with the instructor, multiple options, and initial yet subtle support. Adult learners may resist change, and they will want to know a reason for the change. They resent theory-based actions and want practical knowledge that will help them achieve their goals and build confidence. They want information to be relevant and applicable to their tasks. They appreciate discussion and sharing of knowledge. They will seek greater depth, not just memorization. Learning for this group is usually voluntary, and they look for ways to escape from routine learning to challenge different parts of their brains. They enjoy new challenges, personal enhancements, and new relationships. It is also important to note that adults are generally juggling work, family, school, and personal lives, and may need more flexibility. Adult learners want to be taught useful information, and they will have expectations of immediate results. They understand that the opportunities they enjoy also cost them time and money. The Dreyfus model is an educational theory that applies well to EMS. The novice provider is where we expect students to be at the beginning of their educational programs and clinical education experiences. They will require a lot of prompting and direction, and will need to see how you do things. Students should never be thrown to the wolves, so to speak, on their first field experience shift, but should be allowed to observe, participate, and gradually grow through the levels. Advanced beginners understand their individual skills, but are still working on putting them together in context. They understand limitations and may seek permission before making decisions. Competent providers are still very systematic and may rely on resources, online medical control, and peers. However, they can make decisions and do not need prompting for patient care. They know what is important information for the task at hand, and can function as a team leader. This is the goal of an EMS educational program. Proficient providers make excellent preceptors. They are comfortable with the environment and complex patient cases, but still use some resources and can explain why they do what they do. They also remember what it was like to be a student. Expert providers are often not the best preceptors, contrary to popular belief, unless these providers have been teaching throughout their careers. They may have forgotten many of the systematic approaches to assessment and patient care, often relying on gut instinct rather than systematic processes. These providers can be hard for a student to follow and may become frustrated with a student's lack of progress. As said previously, no student will be expected to achieve proficient or expert levels during an educational program. The goal of any program is to achieve entry-level competency at the designated program level. We encourage preceptors to employ multiple educational approaches when working with students. Faculty of the program may be able to provide some insight if you're having challenges making progress, but you may try some of these approaches. Guided learning allows the student to combine sequences of skills with direction, preventing bad habits. Allowing the student to perform skills only, interjecting when needed then. Returning to observation mode. Consider both verbal and nonverbal cues to prevent embarrassing students, or breaking confidence. Consider asking the students about their learning style so you can adapt your teaching style to help them succeed. Ultimately, our goal is to produce the kind of provider with whom you would be proud to work with in the future. When students participate in field experiences, there are several forms that must be completed fully at the end of each field shift. It is not acceptable for students or preceptors to complete these forms at a later date or time, or beyond the end of the field shift. Please see the Clinical Practicum Handbook for examples of these forms and how they should be completed. When evaluating student performance, be sure you understand the student's stage of development. Students in the formative phases will serve as team members, taking direction and gradually learning to take over patient care. In summative phases, preceptors should be strictly evaluating student performance as competent entry-level providers. Students are evaluated on the 3 learning domains recognized by Bloom's taxonomy, those being cognitive, psychomotor, and affective. This evaluation component is very important to assist the student in their improvement in all aspects of providing emergency care. If the preceptor does not have enough observational experience with the student to grade within a particular category, a grade if not applicable, or an A should be provided. A narrative section exists for additional preceptor comments. Comments must be objective and relate to the student's performance during the field experience. These comments are utilized by the program faculty and staff. The comments should help reinforce positive behaviors and performance while also identifying areas for development and improvement. Once the preceptor completes the evaluation of the student, the preceptor and the student should have a discussion regarding the field experience and the preceptor's evaluation of the student's performance. If there are discrepancies, those discrepancies should be discussed. Documentation must be completed throughout the shift and approved at the end of the shift. Preceptors should not sign off on documentation after the student leaves. In the event of extenuating circumstances, preceptors must contact the clinical coordinator immediately with the plan to complete the evaluations. Preceptors are responsible for verifying that all skills documented by the students were performed under direct supervision. Preceptors may not verify student skills or documentation for shifts that were not scheduled. Student evaluations should not be considered confidential. As a preceptor, you should be comfortable discussing your evaluations with the student. This will assure the documentation is consistent and that the student has a chance to learn from your feedback. Throughout the shift and for each subsequent shift, the student experience is not simply a testing process, it is an opportunity to grow and learn from your experience and direction. The student will need your feedback. If you feel you cannot discuss an issue with the student, please document honestly and follow up in a correspondence with the clinical coordinator. The following tutorial is to demonstrate the proper way to complete the shift worksheet. The links provided here and below in the description will give you access to a blank shift worksheet and the preceding tutorial. The EMS Program shift worksheet has 2 pages, front and back. First, we will be looking at and discussing the front page. Students should fill in the areas noted. Your name, the date, the agency or site, the unit, the shift start time, the shift end time, the total shift hours, and your preceptor's name. Next, we can look at the entry rows on the front. For each patient encounter, the student should denote the following: the age and sex of the patient, your general impression and/or differential diagnosis of the patient, your findings, such as AVPU, sample, and OPQ or ST. A summary of what you did for the patient. And circle which type of patient it was, whether ALS or BLS. Next is the rating for this patient encounter. First, the student should evaluate themselves, whether they felt competent or not competent in each of the categories, or if the category was not applicable for this patient, then place your initials for your self-rating. After the student has evaluated themselves in each applicable category, the preceptor should evaluate the student in the same categories, and initial to confirm same. The next column, labeled Team Lead, should only be initialed by the preceptor if the student conducted a comprehensive assessment, established a field impression, determined the patient's acuity, formulated a treatment plan for the patient, direct the treatments being delivered to the patient, and participated in the transport and transfer of the patient to a higher level of care, or terminated care in the field. Preceptors, you can see the full definition and objective of team leads on the back page of the worksheet. The last column on the row for the patient encounter is for the preceptor to comment anything that they feel needs immediate attention for the next patient encounter. As you can see, there are rows for up to 6 encounters. If you have more than 6, just use another front page and make sure to enter all the same information in the top section, such as student, date, agency or site, unit, time in, time out, total hours, and the preceptor's name. Now on to the back page. Again, the student should ensure that the information about their name, the date, the shift start time, and the shift end time are filled in. The next area is for the preceptor to comment on anything good or bad that the student did or didn't do during the shift. Preceptors, please be honest and give an accurate interpretation of the student. Students, do not take offense to anything that the preceptor writes about you. This is only to help build your abilities and proficiency. The area just below is for the preceptor to give any suggestions for the student to work on for the next and future shifts, building up to an overall plan for the student's success. Again, please be honest and accurate. Next, we have the area that represents an effective evaluation. Preceptors, please mark the items as you find appropriate for the student. We are almost done, but still have some of the most important items on this worksheet to cover. Students, it is imperative that you ensure all the data and information required is entered onto this form. It will only assist you more for when you are entering your contacts and skills into FISDAP. Students, as you can see, you should be signing each of these worksheets. By signing, you are attesting that this was you and that you have your interactions noted on it. If you do not sign it, you will not get credit for anything on the worksheet. Students, it's also your responsibility to ensure that the preceptor signs your worksheet. It's the preceptor's responsibility to ensure that all information noted on the worksheet is accurate. Preceptors, please ensure the student has completed the areas for where demographic data is entered, such as their name, the date, the agency or site, the unit, time in, time out, total hours, and your name in all the required spots. Once you have done so, your signature will attest that all the information is accurate, and that the student was present during the date and times listed. Also, please print your name in the last area as noted. At the bottom of the back page of the worksheet, you will find the category definitions for each of the areas that need to be evaluated on every interaction. You will also find the full definition and meaning of the team lead objective as it relates to the EMS program. This concludes the tutorial for the EMS Program Shift Worksheet. Please review this video and information occasionally to ensure that all aspects of the Shift Worksheet are being completed correctly. This concludes the EMS Program Field Preceptor Training. Please head to the required quiz at the link provided below. You may take same multiple times, as you must achieve a score of 100%. If you have any questions or concerns, please contact the EMS Program Clinical Coordinator by the email or phone number listed here.